All right, a little introduction and how your surgery went.
And surgery was good, uneventful. Thank you.
All right, you like that?
And
like an airline ride, you just as well not have a lot to talk about.
That's exactly right. That's exactly right. August 2nd, and 37 minutes, I think, and a 6-foot bypass. So.
And how's the week been?
Week's been pretty good. I get tired, and it's hard for me to take in all the salt that I'm supposed to have. I drink and drink and drink and drink and drink Gatorade, and I can never seem to get quenched. My thirst is never quenched.
Yeah, and here's the thing about Gatorade. It's pretty good, but there's better.
Okay.
If you're not getting enough oomph from the Gatorade, remember that the Gatorade just has a little bit of salt because it's for civilians.
Mm-hmm.
You know, in other words, people without the MGB drink Gatorade.
Right.
If they put enough salt in it so it would be great for you, then the average people couldn't take it.
Right.
So what to think about is if the Gatorade's not doing it, you need to turn to really high intensity salt sources. And good examples of that are chicken noodle soup.
Okay.
Okay, so instead of drinking Gatorade all day and pushing that, which is okay, if you're still feeling a little short, actually take a salt packet and lick it off your hand.
I've done that too.
Good. Did you notice a difference when you did?
Just nausea, because that's hard. Well, and I had this funny taste in my mouth, and I called Sandy, and she said that was the ketones.
Yeah, do you remember the old diets that you've been on in the past, where you would try and get ketotic, you know, and you'd even buy strips in your urine because you wanted to be ketotic. And do you remember why you wanted to be ketotic and what they were? You're trying to show that your body is burning fat. And you are. Welcome to my world. But the downside is that ketone, like acetone and other kinds of things like that, stinks. It smells bad, it tastes bad, it's icky, you almost can't get the taste out of your mouth, and a lot of times it so messes up the flora and fauna, the bacteria that live in your mouth, you get a thrush infection with yeast. Thank you. We appreciate that. A lot of people do that when I talk to them. It's
Well, and the stuff that you take,
the nystatin,
makes me vomit.
You're supposed to swallow it.
Can't. No, I don't need to swallow it to vomit. It's awful.
Yeah,
What do I do?
Well, that swishing and throwing up is fine. It'll still get better.
Easy for you to say.
Yeah, it'd be nice if here's the thing. So you just said your surgery went well.
Yes.
And you didn't have a lot of pain. You got discharged within 24 hours.
Yes.
And we have the terrible experience of having to swish nystatin.
I know, it sounds
it is a complication. But when you think about major life-threatening surgery, your biggest thing is that the medicine made me throw up. It's terrible, and we wish perfection for your recovery. Sometimes we don't get perfect, and we just have to accept pretty good. But you're right that nystatin can be upsetting. If it really bothers you, another thing you can do is cut back the dose, try and do a little bit less. Another thing you can do is to take anti-nausea medicine, like even a little Benadryl, before you take it. Now, Benadryl has its own side effects of making you sleepy, but if it really upsets your stomach, a little bit of anti-nausea medicine might help.
Well, I have a pretty weak stomach, so it's just the whole, even just putting it to my lips kind of does it. So.
Well, and the thing is, the thrush will pass, even without the nystatin. So.
Oh, thank you.
Yeah, it's going to get better.
I'll deal.
Yeah, it's going to get better.
Awful.
Yeah, it's going to get better.
Okay.
There is another couple of medicines that you can use. The one is called ketonazole, but it's not so easy on your liver, so we don't like to use it. But.
Are there any pills?
Yes, but I don't like them because they're not good on your liver.
Oh, okay.
What happens in your mouth when you get that?
You get a yeast overgrowth, a bunch of yeast which are kind of like a bacteria but slightly different, a fungus. It grows in your mouth like little babies get it. It's called thrush, and it grows in there, and after a while it goes away.
And I've been eating my yogurt.
Bread infection.
What's that?
Little bread infection.
Bread yeast. Yeah, it's a little leavening.
Leavening agent.
Right. But it will get better. You can do the swish and swallow with dilute salt water, you know, and some baking soda and things like that. And they don't help a lot, but they help a little. And but your body is strong and will get over it. And the ketones, which are the fat being metabolized, change the character and the nature of the environment in your mouth and give the yeast a running start to get this infection. And over time, it'll go away.
And over time, will the ketone taste in my mouth go away too?
Yes.
And is there a time frame on that, or just?
It's different for everybody, but it's a couple weeks.
Okay.
Other questions?
Do we have any other questions?
I need an estrogen patch.
Oh, stop. Well, you may need one. I don't know. I don't need one. No. I've been very well behaved, Dr. Rutledge.
It's been great.
Because when the husband says that, he means...
He's playing.
Okay, good.
This is great.
But when a husband says that for real, it means, I beg you, Dr. Rutledge, please put a patch on my wife.
I'm okay.
Do you mind if we take your staples out on camera?
Not a bit, but I have some bruising, so.
Well, we don't want anybody to see that. No, that's just stay right there. I'll come to you. Lift up. Let's see.
Oh. That's what I wanted. That was nice. Can we do that again?
Hold still. All right. Okay, now why do you think that one bruised and not the others? Why do you think that one bruised and not the others? There is, right underneath that, there's two arteries and veins that run along here with your rectus muscles called the inferior epigastric artery and vein. And so if the port goes through there and hits that, you'll get bleeding underneath. And this one probably hit that artery and vein. But that should be fine.
Thank you very much.
Congratulations.
I appreciate you.
You did it.